More signs of an unequal recovery from the COVID-19 crisis. The Red Cross has warned that the inequitable distribution of vaccines will only prolong the social and economic impacts of the pandemic. In Asia, people who are already vulnerable, like women and the poor, have been pushed further towards the edge. Asian Development Bank figures show up to 80 million people have been pushed into extreme poverty across the region since the pandemic began. For more, Francesco Rocca, president of the International Federation of Red Cross and Red Crescent, joins us live. Mr. Rocca, your new research from your organization focuses on 10 countries. Within Asia, which countries are amongst the worst affected?
For sure, the most affected in Asia is Afghanistan. The data on Afghanistan really impressed me. The extreme poverty rate in the urban cities has increased from 41% in 2016 to 55% in the recent months. And this research has been conducted before the August crisis. So the situation now is even more catastrophic. And we are really concerned about Afghanistan. But as you mentioned in the opening, all the continent is affected. You mentioned the figure of 80 million just in Asia, and these 80 million are forced to live in extreme poverty with less than $2 per day. And this is something that is forcing their life to an unacceptable condition. But if these are the figures for Asia, around the world, there are tens of millions that are living the same condition, of course, maybe in different form according to the continent, but in Africa and Central and Latin America, we are experiencing a new form of poverty. Then we have to add, and what we have found, that many millions found themselves in this new condition because once they belong to the so-called middle class, and unfortunately the loss of jobs have brought these classes in being forced to ask for support to our National Red Cross, the Crescent societies, or to other humanitarian organizations, and this is something that it's really sad because it's the consequences of the lack of political will to fix. And the more we will continue this condition, the more we will prolong these socioeconomic consequences, the more the years will take to the recovery. So once we were talking about years, now I'm start to thinking that we must be prepared for decades to recover from this crisis if we will intervene now.
Oh, if we talk about recovery, women, and I quote, pardon me, sorry, Dawn.
It's okay. It has been an uneven and gender unequal recovery, and the socioeconomic ramifications, Wesu and Mr. Rocco, they have been extensive. But why, Mr. Rocco, have women particularly been more affected?
Oh, look, the evidence is, this is something that has been discussed in several occasions in the humanitarian field, because in every crisis, this is not only about COVID, the evidence is, and also about COVID and the socioeconomic consequences, I call the ultimate evidence. I hope the final one that is needed to intervene and fixing. Maybe the women are, of course, part of the cultural legacy that unfortunately is still, we are still experiencing in some countries. But they are the most exposed, especially in the developing countries, to the so-called black market of the job, and not having certain incomes, only dedicated to take care of the house, and this exposed them during the lockdown and the confinements to more cases of domestic violences. We have seen numbers really scaring, and we have a big concern about the numbers that are coming from, for example, from Latin America. And this is something that must be fixed with internal legislation, appropriate legislation that give really and finally fair opportunities to both. So far, this is only another evidence of how the women are always affected in time of COVID, in time when a natural disaster strike, during the conflicts. Women are affected when they are migrants or refugees. So, and together with them, very often the children are also the most exposed. And I would add also about the mental health consequences. The women, the figures are showing that are more exposed than men.
Oh, thanks for that, Francesco Rocca, president of the International Federation of Red Cross and Red Crescent.